Now, from CBS4 News, this is Facing South Florida with Jim DeFede.
Good morning, I'm Jim DeFede, and welcome to Facing South Florida. Another crazy week. The federal government is still shut down. The Mueller probe appears to be closing in on the president. And me, I'm personally obsessed with the Lifetime series Surviving R. Kelly. It is both amazing and truly disturbing. If you haven't seen it, please watch it. Here in Florida, Governor Ron DeSantis' whirlwind news tour continues. He appointed another Supreme Court justice this week, removed the election supervisor in Palm Beach County, and continued his purge of all things connected to his predecessor, Rick Scott. During his first week, he demanded the resignations of all the members of the South Florida Water Management District that Scott had appointed. And last week, he broke with Scott on the issue of medical marijuana. Now, in 2016, 71% of Floridians voted to legalize medical marijuana. Then in 2017, Rick Scott, however, decided that the only forms of marijuana that he would accept were pills or oils, and he made it illegal to smoke marijuana under the medical marijuana laws. The law Scott signed also capped the number of medical marijuana licenses and the number of dispensaries in the state. The courts ruled these limitations were unconstitutional. But rather than concede he was wrong, Rick Scott kept appealing the decision. This week, Ron DeSantis made this announcement.
Over 70% of Florida voters vote in favor of medical use of marijuana for people with really serious debilitating conditions. That is about as big a majority as you can get in this day and age. And it's my judgment that what the Florida legislature has done to implement the people's will has not done it in accordance with what the amendment envisioned. And I look at somebody who may have Lou Gehrig's disease or terminal cancer or multiple sclerosis. I think the Florida voters who voted for that wanted them to have access to medical marijuana under the supervision of a physician. Whether they have to smoke it or not, who am I to judge that? I want people to be able to have their suffering relieved.
So there you go. Light them if you got them. Joining me to discuss what this all means and some of the other DeSantis moves in the state is State Senator Gary Farmer, a Democrat from Broward. Gary, thanks for coming in.
Jim, always good to see you.
Now, soon after, or commensurate with the governor making this announcement, and what he's basically said is he's giving the legislature the first 2 weeks of the session, basically the first half of March, to come up with a bill, and if they don't, fixing the problem, he'll just drop the lawsuit and move ahead on his own. You've written that bill. Tell me a little bit about what's in the bill and what you're hoping to achieve.
Sure, and we had been working on that bill for several weeks. It was always our intention to file it. We were very happy and encouraged not only by Governor DeSantis' statement, but the statements issued by Senate President Galvano and Speaker Oliva that they intend to honor his request. As you alluded to in your opening, or mentioned in your opening, Jim, the will of the voters on this issue is crystal clear. 71% of Floridians voted to allow medicinal marijuana. The amendment itself spoke specifically to the inhalation and smoking of marijuana. It said that you could not smoke in a public place. Clearly, the implication there is that it's okay to smoke it in a private place. And so I do applaud the governor for this move. I thank my partner, John Morgan, for leading the charge on this fight. And again, it goes back to implementing the will of the voters, and the voters have spoke loudly on this issue.
Now, would it have just been easier? Because some people have criticized it and said, why should we even wait till mid-March to give the legislature a chance to act? Why not just drop the lawsuit? Should the governor just have dropped the lawsuit today and implemented the law on his own? Does he need the legislature to act?
Well, I'm not sure what his decision-making process is regarding the timing of the lawsuit, but we did implementing legislation on this issue, and I think it's important to get something in the books that's lasting, that's legislatively done, not only implementing the will of the voters with regards to smoking, but there have been some issues that have arisen regarding the administration of any form of medicinal marijuana. For example, people with Parkinson's or Lou Gehrig's disease, they need the help of a caregiver to administer the drug to them. The law is not clear on that issue. My bill, my draft legislation also addresses that issue and makes clear that caregivers can administer the drug, and and the effect of that would be those caregivers would be paid by third-party administrators.
Critics of the smokable form of marijuana say that you cannot, a judge or a doctor cannot prescribe something. In other words, you can't prescribe a half a joint. You can't prescribe 3 puffs. That it has to be in some sort of quantitative measurement to be able to do it. Obviously, the voters felt a different way. Where do you come down on the issue of whether or not smokable marijuana is really an effective way to administer marijuana?
Well, there is no debate that smokable marijuana is, for some people, the most effective way to get the medicinal impact and palliative and helpful care that it provides. And I think that attack is specious. For every patient, it's going to be different. And this is not about the psychotropic or the high you get from marijuana. This is about the effect of the compounds in marijuana, particularly CBD, that provide that health benefit. And for different patients, the modality of delivery impacts the efficacy of the drug itself. And so people need the option. They need to be able to experiment with how much they need. And as we go along, physicians are going to monitor that for them. And at the end of the day, the patient knows what they're doing.
Does the bill that you're proposing make any changes regarding business licenses, the ability of local communities to zone out dispensaries? Are you affecting any of those issues?
No, the bill does not currently address that, but that's certainly something I'd be willing to work on, and I'm happy to work on. I do agree with the governor again on that point. I think we need to expand access to this drug. I myself have met with some of the cities in my district because, you know, you've got a lot of moving parts here, Jim. For example, years ago with the opioid epidemic, a lot of municipalities passed zoning laws so you didn't have too many pharmacies open up. Dispensaries are considered pharmacies under the law, but it was never the intention that a marijuana dispensary be treated as a retail pharmacy with regard to some of those zoning bills, zoning laws. So there's a lot we need to address.
Well, let me ask you that. Do you think that, for instance, let's say a city like Miami Beach or a city like Hollandale Beach, if they wanted to create zoning ordinances that effectively prevented the opening of any dispensaries within their city limits, by again, through zoning laws, should that be permissible?
No, I don't believe it should. I understand the goal or desire to not have these dispensaries, for example, very close to schools or perhaps some other locations, but you cannot effectively zone them out of existence. To prohibit them would be wrong.
But also, do you have to be careful not so that they are not zoned so that they're only in poor neighborhoods, for instance?
Absolutely, absolutely. And Jim,
does the current law allow that, or is this an area that may need to be addressed by this legislative session?
I think it's an area that we need to address. I think we need to provide greater clarity on this issue.
All right. I want to sort of take a step back for a second and just talk about, you know, this move was a little surprising by Governor DeSantis. He's been in office 2 weeks. It feels like he's been in office for 4 months based on many of the moves he's made. Give me the 2-week score of how you see Governor DeSantis so far.
You know, I have to say, I think he surprised a lot of us on the Democratic side. You know, I was a sponsor of the Groveland 4 resolution to provide a long overdue pardon for 4 men who were wrongfully accused and in 2 cases convicted of a rape that they did not commit. That was one of the first matters he took up.
70 years ago. It's taken 70 years
since
ago
1949, and we passed that resolution unanimously in the House and the Senate 2 years ago. And unfortunately, the Scott administration did nothing on that issue for 2 years. So between Governor DeSantis' announcement on funding for environmental issues, cleaning up our water, restoring the Everglades, we're very encouraged by that as well. Now, there are open questions still regarding the implementation of that. How are we going to pay for it? We have other areas where we need funding, specifically public education and health care. You know, with the fact that we have not expanded Medicaid in this state is having a dramatic fiscal impact on us and on our providers. We've got Chamber of Commerce reports, I think, $1.8 billion a year in uncompensated medical care. Expansion of Medicaid would help deal with that issue. It would save us revenue streams that we could apply to things like Everglades restoration or clean water. So there are more devils in the detail, if you will, but we're very encouraged.
The one thing that I'm curious by is the South Florida Water Management District. He's called on all of them to resign. What did you think of that move? I
thought that was a very strong move on his part. He cannot remove them, but the South Florida Water Management District has been an impediment to restoration of the Everglades and to other environmental issues in general. And if they're not going to act in a way that serves all Floridians and protects our environment, I think the governor is right to call for them to step down so we could put some people in there that will act.
Stay tuned. We'll be back with State Senator Gary Farmer. Thank you very much.